is we accept queries from patients. So patients can actually submit a question that we would do research on, so that's a little bit different. And as well, we have patients involved in our governance structure, so we have quite an elaborate governance structure, and patient partners are either part of them or they co-chair those different committees. And then we also embed patients on projects. So we would work with patients and they would co-create a project together with us. So not only can they submit a question and be part of the governance, but they can also be a member of the research team.
And why do you feel so strongly that incorporating patients into this decision-making is useful for medical research?
I think it's fantastic because hopefully it'll make it more relevant. At the end of the day, we're all trying to better patient care and make patient care in Canada even better. So hopefully by providing the patient perspective and having them on the team, not only does it build capacity in Canada and it build an appreciation for research, but also will hopefully make our research more relevant and more timely, and will increase the uptake of our research findings and reduce research waste. We also have individual patients submitting queries, so that's a little bit of a different process whereby we collect all of them over the year and we have a database of patient queries, and then we prioritize them and we answer one or two per year. So we have had some clinics, so some healthcare provider clinics submit questions. We have a lot of professional organizations, policymaker organizations, and then we also have patients that are submitting questions as well.
And you mentioned some really nice initiatives for benefiting First Nations patients in particular in Canada.
Yeah.
What are such steps the strategy is taking for that?
Yeah, so that's a great question. So for the Spore Evidence Alliance, what we're doing is we have a few paid positions where we have some trainees, so PhD students, as well as staff who are going into Indigenous communities and working with them. They have developed trusting relationships over many different years, and going in and working with them so that they could submit some questions to the Spore Evidence Alliance. So it can't be me. I'm not an Indigenous person, and I'm actually not an Indigenous researcher, so I have to rely on researchers that are part of my initiative to go in and work closely. They have those trusting relationships in place already, and we're hoping that we can start answering questions that arise from the Indigenous